something that Charlotte and I take really seriously in pelvic health physiotherapy. So we've put this short video together to explain a little bit more about what's involved in our practice and our consent procedure. So the importance of consent with respect to examination and treatment options in pelvic health are that obviously it keeps both patients and staff safe. It's really, really important to be transparent on both sides, and we really encourage you to tell us exactly how you're feeling about any particular part of an assessment and treatment plan. How we run our sessions are we generally start with a history taking where we will listen to what's been going on and what your main concerns are, and then after that we'll be giving a recommendation as to which structures or systems we think we should be examining. In a pelvic health clinic, it's normal and quite common for us to be thinking about perhaps your lower back, your pelvis, your hips. Sometimes we actually are looking also at the whole body in standing, so shoulder position, ankles and knees. And then understandably, when we're thinking about bladder and bowel symptoms, pelvic pain, prostate concerns, that might also involve a pelvic floor examination, which we can do visually, i.e. by looking externally at the genitals and or back passage, or internally either via the vagina or the back passage. All of these systems we would discuss with you in detail about exactly what's involved, but I'm just going to give you a bit of an overview now. So for a typical external examination, we might have somebody in standing and we might ask them to undress to bra or perhaps a vest top t-shirt or something that we can roll up so that we can expose the lower part of your back. And we might also roll down the top of your trousers depending on how high they sit. You might want to give your outfit choice some thought perhaps to make that a little bit easier. Some patients just prefer to undress from the waist down or wear something quite tight fitting so that we can see the structures more easily. And then we might do some tests in standing and follow that up with some further tests on the couch with a similar degree of unclothing. If somebody has a particular issue with their hip or their glute area, it might be that we need to palpate the muscles and therefore removing clothing from around the back of your hip in the thigh might be required to do that assessment. A vaginal examination typically involves a single digit gloved, gelled examination. It begins by having a look at the genitals from the outside, the vulva, the condition of the skin. We check skin sensation through touch from the inner thigh all the way down to the vulva and back passage, and then have a look at your muscle movement if that's something that we're wanting to look at from the outside without anything going internal. And then at that point we would check in with you and make sure you're happy to proceed with the internal part of the examination and continue with a single digit vaginal examination. Very similarly, we can do this with a rectal examination. The differences between the two are purely around what we're trying to gain from the assessment in terms of understanding of the problem. We would talk that through with you as to why we're choosing one or the other. And from a logistical point of view, a vaginal examination is typically done with the person laying on their back and their knees bent up. A rectal examination is usually done with somebody laying on their side. Of course, we always try to optimise people's dignity by covering over with a sheet, and all care and attention's taken with respect to health and hygiene. It's really important to finish this video by saying at any point in a procedure, before, during, towards the end, you are very, very welcome to change your mind and just let us know that you'd like the procedure to finish at that point. We're not dealing with a life and death situation, so it's absolutely fine to just put a pause. We can always come back to things next time. It's really important for people to feel that their bodies are being respected and that they feel in control of the situation. From a therapist point of view, obviously, the more you can communicate to us, the easier it is for us to do our job. Nobody's wanting to make anybody feel uncomfortable or uneasy, so please do just let us know at any point. If you're feeling uneasy about the concept of coming for an examination even before your exam or your assessment perhaps, just drop us an email, or we can take a telephone call and talk you through in a bit more detail. Charlotte and I are always really happy to do that if anyone feels like they need a little bit further reassurance or a bit more advice on what exactly might be happening. And the other options are, it might be once the physio's explained to you this is what their recommendation is, you can always go away and think about it and come back another time. The other thing we do offer in our clinic is chaperones. We don't have chaperones on standby for every single assessment, so it's really, really helpful if you'd like somebody to sit in and just observe the assessment or treatment session. Not a problem whatsoever. Please just let us know and we can arrange that ahead of time to make sure that you can get the most out of every appointment. It might be possible if you let us know on the day, but the chances of that are less likely, so it's much better for us to know in advance if that's something that you would like. Other than that, please do, as I say, get in touch if you've got any other information that you require, and we'll do our best.